Hello, and welcome to the Dr. Suzette Glassner podcast. If you'd like to continue to learn from me, please remember to hit like and subscribe to my channel. Earlier this month, a study, the first of its kind, was published indicating that Ozempic effectively reduced alcohol cravings and drinking behavior among adults with alcohol use disorders. So today, we're going to talk a little bit more in depth about the promise of GLP-1 agonists like Ozempic for treating drug and alcohol addiction. So let's start with, how do GLP-1 agonist medications work? First of all, GLP-1 is known as glucagon-like peptide 1, and it's actually a hormone that is released by your digestive system and parts of your brain after eating. So what GLP agonist medications do is they mimic the effects of that hormone, and the function of that hormone in part is to let our body and brain know that we've had enough and we don't need to eat anymore. So this has had very powerful weight loss effects. We know that around 15% of a person's body weight is effectively lost when they are on a GLP-1, and that has really been transformative for many people who struggle with obesity and weight management and control over their appetite and their food intake. So addiction scientists actually took an interest in GLP-1 agonist medications after some people who were taking them for other indications like diabetes noticed that in addition to suppressing their appetite, they also didn't really have the usual desire that they had either to drink or smoke. And so it's really seemed to be reducing cravings for addictive substances. And even though the reasons that these medicines act in these ways are not really yet well understood, we can make some assumptions based on the way that GLP-1 agonists work on eating. So we know that GLP-1 reduces dopamine, and dopamine is that feel-good pleasure chemical that is released when we're about to eat something, or we're eating something that's delicious, or we're anticipating pleasure or experiencing pleasure from other activities. So when a person has food in front of them that they normally really like a piece of cake or a dessert or just a juicy hamburger, without the usual amount of dopamine that's released, they're not going to have that same kind of excitement about eating it. So if you extend that to understanding how drug use and addiction work, without that strong desire or urge or craving for that piece of cake or that juicy hamburger, people become less likely to want it. Well, what if we could achieve the same thing for substances that are highly addictive, where there might be something tempting right there in front of a person, like their favorite kind of alcohol, or maybe someone around them who's using substances, but they don't get that same anticipatory kind of excitement that is prompted by the release of dopamine because they're not releasing as much on a GLP-1. So if we could achieve that, then the desire to use alcohol or drugs compulsively would be dampened, and that could really help us overcome addictions. And this is a bit different from the way that many of the FDA approved medications that we have currently in place for addiction work, which is that many of them reduce the enjoyment of some of those experiences of drinking. They reduce the reward and the pleasure directly experienced from drinking or using other substances. This might actually tap into a different mechanism, which is the kind of excitement, the desire, the urge, and the craving before you've even engaged in the behavior of using a substance. So as of today, there have been 2 randomized clinical trials evaluating a GLP-1 agonist for the treatment of an alcohol use disorder. So the first study, which was larger than the second, and that included over 170 individuals, did not find reductions in heavy alcohol use after 26 weeks of treatment with the medication, except among individuals with obesity who had a BMI of 30 or greater, as well as their alcohol use disorder. So now this newer study that was just recently published is actually a much smaller study, about 48 people. But what they did was they enrolled people with an alcohol use disorder into their clinical trial, and they randomly assigned them to a group that got a low dose of Ozempic over a period of 9 weeks, or a group that got a placebo medication. A placebo is a substance that's given to people in a clinical trial that actually doesn't have an active medication in it. So those are the 2 groups that were compared. And they tested drinking behavior in a simulated drinking environment. So what they did is, before they started treatment with Ozempic or the placebo, and 9 weeks later, they would come into a laboratory setting. The laboratory was made to look like a living room. It was very relaxing. They could watch TV. They had a bar fully stocked with their favorite alcoholic beverages, and they were instructed that they could drink as much as they wanted to. And then the amount that they drank and their blood alcohol levels were measured before and after they finished that 2-hour session. And then they looked at how much did they drink at that that pre-treatment session before they started taking Ozempic or a placebo, and then how much did they drink after 9 weeks of weekly injections of low-dose Ozempic or placebo. What they found was that at the end of the 9 weeks, individuals who got Ozempic drank significantly less than the individuals who had the placebo. So they actually drank around 40% less in that simulated laboratory environment. Now, then as a secondary question, they evaluated how much were they drinking out in the real world in their natural life. And this is where the results are a little bit mixed. On average, per calendar day, they didn't change their drinking outside of the laboratory setting in a significant way. They also did not drink on any fewer days out of the past month or months at 9 weeks after having Ozempic every week than they did before. But when they did drink, they drank fewer drinks. So if they drank 3 times in a week, where they used to drink 7 drinks a day every time, maybe they were drinking 5 or 6. Although it didn't promote abstinence, it did promote a reduction in alcohol use. We saw that in the laboratory setting, and then we saw that in the reduction in heavy drinking on the days when they did drink. And that's actually pretty well aligned with the direction that the field is going, where we are understanding more and more that abstinence as an only goal is not really the gold standard in our field anymore, because we are seeing that there are health benefits and health impacts of changing or reducing one's drinking. There are impacts on liver function, there are impacts on overall mental well-being and one's feeling of control over their alcohol use. Now, that's not for everyone. For someone with a severe addiction, controlling one's alcohol use may not be feasible in the longer term. Another interesting thing that they found, even though they had a very small subgroup of people who were smokers, those who received Ozempic reduced their smoking behavior. So why this is exciting? Since GLP-1 agonists act on brain circuits that are generally tied to reward and pleasure, both from food and drugs, it's possible that these medications may be therapeutic for people who are addicted to more than one type of substance. Currently, all of the FDA-approved medications for addictions are for a specific type of substance use disorder, but we don't have any FDA-approved options for addictions to multiple substances. And then second, if you think about the message it sends from a physician who is prescribing Ozempic for weight control, it sends a message that this is sort of a normative problem in our society. Obesity is recognized as a medical issue for which medication treatment can be effective and should be aggressively prescribed in order to reduce the risks of other overlapping chronic diseases that could stem from or become worsened by one being overweight or obese. Imagine if we could extend that to the field of addiction treatment. Addiction is a highly stigmatized condition, and even though we do have effective medications for addiction, they are very much underprescribed and used by a very small proportion of individuals who could benefit from it. So offering something like Ozempic as a potential treatment option for addiction can really help people in the medical field and outside of the medical field to understand and appreciate addiction as an illness and therefore really destigmatize it. So what can you do now? So it's not FDA approved, and that's something that's important to keep in mind. And it's a long road to get a medication FDA approved. You have to have different types of studies. You have to study the safety of the medication. Then you also have to do randomized clinical trials in larger numbers than what we've seen so far today. All of those sources of data need to be gathered, usually over many years, and submitted to the FDA before a medication can have FDA approval. And the FDA approval gives you a certain degree of confidence that this is a very well-studied medication in terms of safety and efficacy. So if it has undergone that level of investigation and inquiry scientifically, you can still ask your physician to prescribe it. And that's what's known as prescribing something off-label. Off-label means it's not approved for that indication. Ozempic is approved for certain indications, diabetes, for example, and to prescribe it in order to overcome an addictive behavior would be considered off-label because it's not an FDA-approved indication. That said, off-label prescribing is a very common practice in the practice of medicine. So if you feel comfortable with your understanding and with a discussion with your medical provider about the risks and benefits and what is known about Ozempic for your condition, if it's addiction or if it's another condition, then you can ask them to prescribe it off-label to you. One of the other benefits of FDA approval, however, is that it impacts the cost of the medication. So it could be very costly for individuals taking it for an indication for which it's not approved. And that's just a consideration to keep in mind. Second, we just have to be very aware that research is in very early stages. With support for accelerated research that's currently in place, there are a number of clinical trials that are currently ongoing that are funded by the National Institutes of Health to try and fast track our knowledge base about the effectiveness of these medications for substance use and addiction. I hope that you found this information useful today. If you're interested in learning more about FDA approved and off-label unapproved medications for different types of substance use disorders, please check out my new book, book, Addiction: What Everyone Needs to Know. And I look forward to seeing you next time.